There are many different kinds of mental disorders. In fact, I could do an entire video series just on different kinds. But for this video series, I'm just going to try to talk about all the major ones in a single video. So one of the big ones, one of the ones that most people are very familiar with, even though it's extremely uncommon, are the psychotic disorders. So psychosis, this is a loss of contact with shared views of reality. It's like these people are on another plane of existence. And psychotic disorders are typically marked by hallucinations and delusions. So a hallucination, that's just a mental image. That's an imaginary sensation, like seeing things or hearing things or smelling things. But the thing that differentiates a hallucination from a mental image, that hallucinations are often confused with reality. Like when you hear things, hearing things is the most common kind of delusion. And when you do hear things, like you hear voices, it seems real. Now that other thing I mentioned are delusions. So delusions can come in many kinds, but these are just false beliefs that a person insists are true, irregardless of sometimes overwhelming evidence against it. So like I said, there's a lot of different kinds of delusions. There's depressive delusions, where the person feels that they're unworthy or they're a bad person or that they've committed some terrible crime. There's somatic delusions. Every time you hear the word somatic, you should think body. Somatic delusions, believing that there's something wrong with your body. Like maybe parts of your body are rotting away, or maybe parts of your body aren't even yours. Like maybe you'll have this delusion that your hand is actually somebody else's hand that was put onto your arm. Or maybe there's something wrong with the inside of your body. Like maybe you have some kind of weird parasites or something like that. Then there's delusions of grandeur, where you believe that you're special, like you have some great talent, or you're like the chosen one or something like that. Then there's delusions of influence, where you believe that people are controlling your thoughts or controlling your behavior. Sometimes it can be like governmental control or aliens or some kind of spiritual thing. And then there's delusions of persecution, where now the person feels like other people are out to get them. Like there's either a mass conspiracy, or it's just a small group of people that are trying to hurt them in some way. And then finally you have delusions of reference, where the delusional person will give great meaning to unrelated things. Like they'll find cause-effect relationships where it's just clearly a coincidence. Like they'll see like a squirrel run across their lap at the park, and they'll assume because of that they're going to get hit by a car later or something ridiculous. Like these things clearly aren't related, but they make those connections. Other symptoms of psychosis would include having a flat affect, so just being completely emotionally unresponsive, or having just a completely frozen facial expression, having disturbed verbal communication, just having speech that doesn't really make any sense, having garbled or chaotic speech. You might call it word salad. And finally, there's personality disintegration, where the different aspects of the person, their thoughts, their actions, and their emotions, they just don't seem to match anymore. So they might, for example, they might tell you how sad they are about something that's happened, but at the same time they're telling you this, they're also smiling or laughing. And that can be really kind of, disturbing to see somebody with that kind of disintegration. Now, when it comes to how people develop these kinds of psychotic symptoms, well, there's many reasons. Some reasons are more organic. Some reasons are due to deterioration of various brain areas. A couple examples of these organic psychoses would include Alzheimer's and dementia. And with both of these, the hallmark is, memory loss, mental confusion that seems to just get worse and worse and worse as the disease progresses. But dementia is a little bit different. It's considered a little bit more serious because the person is, completely confused. They seem to have no idea what's going on. Some psychotic disorders are almost entirely marked by their delusional, beliefs. So we could call these delusional disorders. And typically the delusions that these psychotic individuals have are not so bizarre. Usually there is like a nugget of truth there, so you can understand why somebody might believe it, except for the fact that these delusional people, they just take it way too far, and they just ignore every piece of evidence that goes against their delusional belief. One of the most common delusional disorders is paranoid psychosis. This centers on delusions of persecution and grandeur. So the person thinks that, people are out to get them because they're special in some way. It's like, I'm such an important person that clearly other people have to take me down, or there'll be like some great revolution or something. Just as a side note, if you have any kind of paranoid beliefs, I don't want to necessarily write that off as a delusion. It's perfectly normal to be paranoid from time to time. It's only really a delusion if you just don't really have any evidence to support it. So if you do have paranoid beliefs that the government is spying on you, well, they kind of are. I have a link down in the comments below where you can read more about it, but the long story short is everything you do online, every text message you send, it's being saved and searched. And just be careful what you do online as a result. So some other kinds of delusional disorders would include things like erotomanic delusion, where you have these like romantic delusions about being loved by somebody else, most often a celebrity. Grandiose delusions, where the individual will believe that they're unique or important, or they have some kind of special knowledge or talent. Jealous delusions, where the person will feel this overwhelming sense of like belief that their lover or their friend is being unfaithful to them. As you can imagine, this causes a lot of relationship problems. Persecutory type delusions, where the person will believe that they're being conspired on, cheated, spied on, followed, poisoned. It's just they feel like the world is out to get them. These people don't obviously get out very much, and they don't have very many friends. And then you have those somatic type delusional disorders. Remember, somatic means like something wrong with your body. So people who have these kinds of delusional disorders, they're the ones who, have this deep and all-consuming belief that there's something wrong with either one or more parts of their body. And this kind of disorder can lead people to do some pretty extreme things. Like, it's not entirely uncommon that people with this disorder will undergo things like unnecessary self-surgery. By far the most severe, the most well-known kind of psychotic disorder would be schizophrenia. So schizophrenia is like all these other psychotic disorders in the sense that it's marked by hallucinations and delusions, but it also has some other features to go along with it too, like like a sense of apathy, thinking abnormalities, and like a split between the individual's thoughts and their emotions. A lot of people confuse schizophrenia with, dissociative identity or multiple personality, but these are very, very different disorders. Now, I have a link down in the comments that goes into a lot more detail about what schizophrenia is and the different kinds. But to go into some more detail just about those kinds, more detail than the video goes in, I'd just like to mention that there are basically 4. So the 4 kinds of schizophrenia would be disorganized type, catatonic type, paranoid type, and undifferentiated type. So it's the paranoid type schizophrenia that most people have seen in movies and heard about. These are the kinds of people that are preoccupied with, these delusions of persecution. They think the government is trying to get them, or the aliens, or whatever. Somebody's trying to hurt them. And like I said before, people with paranoid type, they tend to also have elements of grandeur, where they think the reason why all these people are trying to get them is because of something special about them. Though it's extremely uncommon for this to happen, even young children can get paranoid schizophrenia. So I just have a link to a short video from a documentary on a child with paranoid schizophrenia. Those other types I mentioned would be like disorganized type, where the individual has kind of an incoherent speech, incoherent behavior, grossly disorganized just actions, bizarre thinking, or just really inappropriate or flat emotional expression. There's a link in the comments to an interview with somebody who has this disorganized type schizophrenia. I also have a link for somebody showing catatonic type, but this video shows an actor, so it's not an actual person who's suffering from it, but it's a very accurate depiction of what catatonic type schizophrenia looks like. And basically what it looks like is the person has really, really bizarre behavior patterns. So those behavior patterns can be many different kinds, but the classic example of catatonic type schizophrenia is when the individual has these persisting, like sustained, bizarre postures. Like you might see somebody sitting like this in a chair for like hours and hours and hours, like they never move a muscle. That's an example of what catatonic type schizophrenia might look like. And then the fourth kind that I mentioned is undifferentiated kind. So with undifferentiated schizophrenia, the individual clearly shows these signs and symptoms of schizophrenia, but they don't really fit into any of these previous three categories I mentioned. I already mentioned that organic things can cause schizophrenia, so like, degrading parts of the brain, like as you get older, some parts of your brain might start to have decaying, neural synaptic links and things like that, and that can cause things like Alzheimer's. So various diseases can just cause an overall, decrease in brain functionality, leading to schizophrenia and psychotic disorders and things like that. But other factors would include things like early, childhood trauma, having a dysfunctional family. We know that's a big risk factor. There actually seems to be some genetic predispositions for various kinds of psychopathy, various kinds of schizophrenia. And going along with that, there's also certain genetic mutations that have been linked to developing this disorder. A different class of disorders would be the mood disorders. And there's many different kinds. You have major mood disorders, which are characterized by lasting extremes of mood or emotion. So like major depression, for example. Like a major depressive disorder is when a person just feels an overwhelming sadness, despair, or hopelessness for a long period of time. Usually people with major depression, they just kind of lose their inability to experience any pleasure. Something similar to depression would be bipolar disorder. So bipolar is also a mood disorder, but the big difference between bipolar and depression is that bipolar, while it has these periods of deep depression, it also has the opposite. It has periods of what's called mania. So mania is quite literally like the opposite of depression. When a person's depressed, they don't want to talk, they don't want to do anything, nothing is pleasant for them anymore. They don't really see a point. But when you're manic, everything is stimulating, everything is exciting, everything is enjoyable. Mania might sound great, but the bad news is that people with bipolar are actually much more likely to hurt themselves and others, or even kill themselves and others, while manic. Because when they're depressed, they're basically just laying there like a lump on the floor. They're not really doing much. But when they're manic, they're hyper, they're energetic, they're running all over the place, they're doing all kinds of things. A lot of people who are experiencing mania, they report feeling like a superhero, or even like a god. So these people will take, ridiculous amounts of risks. They will literally jump off of buildings because they think they can fly, or run into traffic because they don't think the cars can hurt them. But that's bipolar 1, where you have these extremes of both kinds. There's also another kind of bipolar called bipolar 2, and that's mostly marked by deep depression, but there's periods of also like a mild mania. Something that looks pretty similar to bipolar, but is very mild in general, is called cyclothymia. So cyclothymia, you can just think of that as like a mild form of bipolar 1, where you have mild mania followed by mild depression. And when it comes to a more mild form of just depression, the term we use for that is dysthymia. Now, dysthymia means that you don't really have these deep periods of depression. You're always just kind of lower than most people. You're always kind of slow. You're kind of down. The character I always think of when I think of dysthymia is Eeyore. And just like psychotic disorders, mood disorders can be caused by a wide range of things, like biology. So, having different levels of neurotransmitters. We know certain neurotransmitters are associated with depression, like serotonin. So if you're just genetically predisposed to not have enough serotonin, you're going to be dysthymic, to put it simply. But other theories have also proposed that depression can be caused by rage turned inward. So that's the psychoanalytic theory of depression. Behaviorists would argue that depression is what happens when you experience learned helplessness. And cognitive psychologists would say that depression is the result of self-critical, negative, irrational thoughts. Women are 50% more likely to experience depression than men. So depression is a very serious issue amongst women in this country, and I would assume most countries. And the research into why this is the case has produced some pretty obvious results. Women tend to be more depressed because of societal and environmental factors. To put it simply, in our country, women are given a lot of crap. Women are, told what to think, told what to do. They're told to be successful businesswomen and successful mothers. And if they don't do 100% in both of these, then they're thought of as being failures. I mean, there's just so much garbage that women have to deal with in our country that it makes obvious sense why they tend to be depressed at greater rates. But another kind of depression that seems to only really affect women are what we call the baby blues. And there's different kinds of depression that are associated with becoming a new mother. Maternity blues, that refers to a mild depression that most mothers will experience shortly after birth, just for a couple days. And the logic behind that is, when the baby is in the womb, the baby is giving the mother happy chemicals. The baby is helping the mother's hormones to make her feel better. But once the baby's born, suddenly those happy baby chemicals are all gone. So the mother has to adapt to that, and it takes a couple days. But a far more serious kind of baby depression would be postpartum depression, where the mother will become moderate to severely depressed within the first 3 months of taking care of this new baby. And that depression, that postpartum depression, it varies from mother to mother, but it can be so serious that the mother is basically bedbound. She can't do anything. She basically just gives up. She doesn't even try to do anything anymore. And I've heard of cases of this postpartum depression lasting for the first full year of that child's life. So it can be a very serious condition. A relatively similar class of disorders would be the anxiety disorders. But anxiety and depression, these are very different things. Anxiety is more so about having frequent, fearful thoughts about the future. That's definitely one of the most common psychological disorders out there. And this results in approximately 4 million visits to doctor's office in the US per year. One of the most major kinds of anxiety disorders would be generalized. So generalized anxiety disorder is basically when you're anxious about everything. And that can last for at least 6 months. So that's just like chronic, unrealistic, and excessive anxiety about your life, about things that are going on in your life. And just like depression, this tends to affect women to a greater extent than men because of those same social and environmental factors that we have in this country. Other kinds of anxiety disorders would include things like panic disorder. So panic disorder is this chronic state of anxiety. It's this chronic fear, it's this chronic worry about having a panic attack. And a panic attack is just when, it's really hard to explain if you've never experienced one, but when you have a panic attack, it's like an episode of overwhelming, choking anxiety, fear, and terror. It's just, when you're having a panic attack, it really does feel like the world is ending, like the world is collapsing upon you. It's extremely terrifying if you've never had one. So panic disorder is all about being afraid of having these panic attacks, and the sad thing is when you're very afraid of when you're very afraid of having panic attacks, that can actually cause the panic attacks to occur. And a lot of people who have this kind of panic disorder, because they're afraid of having a panic attack and not being able to, hide or get away, they don't want people to see them having this panic attack. So a lot of people who have it will actually also have agoraphobia. And that just literally translates to fear of the marketplace. So they will not want to go outside. They will not want to leave the safety and comfort of their own home. Where if they do have a panic attack, at least nobody will judge them for it. So agoraphobia is just one kind of a long, long list of specific phobias. So specific phobias are these irrational and persistent fears and anxiety and avoidance of certain kinds of things. Most people have one or more specific phobias. Some of these phobias are extremely common, and they seem to be relatively innate. I briefly talked about that in a previous video. But there are a lot of phobias that people experience that are very, very kind of bizarre. So the most common kinds would be things like acrophobia, fear of heights, agoraphobia, fear of crowds, arachnophobia, fear of spiders, claustrophobia, fear of closed spaces, aquaphobia, fear of being in or on water, and aviophobia, fear of airplanes. So those are some of the most common ones. Another kind of anxiety disorder would be OCD, or obsessive-compulsive disorder. This is an extreme preoccupation with certain thoughts and the compulsive performance of certain behaviors. So the obsession part of obsessive-compulsive disorder refers to persistent and involuntary thoughts, images, or impulses that cause great distress, like feeling dirty or feeling like something is out of place. Compulsions, on the other hand, those would be persistent, irresistible, and irrational urges to perform some act repeatedly. The most common kinds of compulsions would include cleaning and washing, counting, checking things, touching objects, hoarding certain kinds of objects, or just excessive organizing in general. It's really hard for people who don't know somebody with OCD, it's really hard to understand what's going on in their head. But here's the basic idea. A person who has OCD, they're just never satisfied. I'm pretty sure I talked in one of these videos about how in the limbic system we have a pleasure center. And every time we do anything good, like wash our hands, eat a good meal, give somebody a hug, whenever we do a task that we feel is a good thing, chemicals are released by the pleasure center that basically say, hey, you did a good job, good, high five. And that makes us feel happy. People with OCD never get those chemicals. So when they wash their hands, they don't feel satisfied. When they cook a good meal and eat it, they don't feel better. They don't feel happy. They don't feel like they feel full, right? But they don't get those chemicals that we all naturally do, and as a result, they're just not going to feel like they've done a good job. So they'll repeat it over and over. They'll wash their hands over and over and over and over because they're desperately trying to get those chemicals that we all take for granted. And then there's the dissociative disorders, like dissociative identity, or DID. Dissociative identity disorder used to be known as multiple personality disorder, and it kind of is what it sounds like, but not really. So with dissociative identity disorder, what's going on with this person is that they have two or more distinct personalities, and they will go from one to the other depending on the situation. Only one state, only one identity will be present at any given time. But it's not necessarily the case that, a person with dissociative identity, it's not necessarily the case that at one point they're Steve and the next point they're Karen or whatever. It's more so that they're just different sides of the same coin. I mean, it could be that, they're Steve one day and Karen the next, but it's more likely that it's going to be like good Steve and bad Steve, or childish Steve and mature Steve. It's just different versions of the same character. Other kinds of dissociative disorders would include things like dissociative amnesia. Dissociative amnesia is something that can occur due to trauma or head injuries and many other kinds of things, where the person will have complete or partial loss of their ability to remember things about their lives. What's commonly thought of as like a very extreme form of this kind of dissociative amnesia is called dissociative fugue. So with dissociative fugue, not only does the person forget who they are, but then they also will travel far away and kind of start their life over again somewhere else. It's kind of like this person is like hitting the reset button on their life. And then there's a long list of somatoform disorders. And remember, somatic, that means body. So somatoform is like a mental disorder about your body. And there's many different kinds, but the major ones would be things like hypochondriasis, where the person has these preoccupations with potentially becoming sick or potentially being sick. And they will interpret normal body sensations as signs of some deadly disease. It's like they'll feel like this weird, rumble in their stomach area, and then they'll start to believe that, they have some hideous parasite that's eating them from the inside out, when most of us would just feel that rumble and say, oh, I'm hungry. Like they go way off into left or right field when it comes to trying to interpret normal things. But what seems to be a much scarier kind of somatoform disorder would be Munchausen syndrome and Munchausen syndrome by proxy. With Munchausen syndrome, a person will fake to have a serious medical problem because they're trying to get somebody's attention. So it's like they're trying to get the doctor's attention or their loved one's attention. So they just constantly complain about being sick. And that's not so scary, but what's really scary is Munchausen syndrome by proxy, where the person will pretend somebody else is sick so that they can take care of them. So it's like they're trying to convince somebody else, like a child or a loved one, that that person is sick and should stay in bed and let them, mommy them, to put it simply. Otherwise their condition could get worse. And not only is that just kind of socially, some weird kind of social influence, but sometimes this disorder can be so severe that the person with Munchausen syndrome by proxy will actually take it to the next level and literally make that individual sick. Not too long ago, I heard about something in the news where a mother, after her son died, a mother was found out as having poisoned her son for years because she wanted not only his attention, but she also wanted the attention of people on the internet that she would talk about this with. So she would poison her son and then talk about how horrible it is that her son has to suffer like this to strangers on the internet, because she craved that attention. She needed that attention. Other somatic disorders would include things like somatization disorder, where a person will, like their anxiety will come through as like a physical thing. So they'll have like deep anxiety that represents itself physically. Medical doctors will, recognize that this person is in real pain, but they simply won't be able to find a cause. Because remember, it's somatic. It's psychological in origin. Then there's pain disorder, where a person will experience pain, but it has no real cause. It's not really caused by anxiety necessarily. It's just this is like some weird phantom pain. And then there's conversion disorder, where the person's emotional conflicts will be converted into physical symptoms. Like maybe they'll become so depressed that they'll become unable to walk or something like that. The last kind of disorder I wanted to talk about in this video are the personality disorders. And there's a lot of different kinds of personality disorders. But these can just be described as maladaptive personality traits. So it's not a disorder in the same way that a lot of other ones are. This is just, having developed a personality that doesn't really allow you to work well in society. It doesn't really allow you to, live a good life. So these disorders are deeply rooted. It's at the core of these individuals' personality. So treating these kinds of personality disorders can be very, very difficult. But a few of the more common ones would include things like paranoid personality disorder, narcissistic, person who needs constant admiration, dependent, a person who has a personality involving extremely low self-confidence, and histrionic, where the person is constantly seeking attention by being overly dramatic. I think we all know somebody in our lives that have, histrionic personality disorder, though most of us would probably just call them, like drama queens. The one that I'm sure you're most familiar with, because it's talked about a lot, are the people who have antisocial personality disorder. The hallmark of antisocial personality disorder is the complete lack of empathy. So these individuals, they literally can't care about the suffering of others. They have no feeling. When they see somebody else in pain, their autonomic nervous system does not react. Their heart rate won't speed up. Nothing changes for them. It's like watching somebody in pain is about as exciting for them as watching paint dry. They don't care. We often call these people psychopaths or sociopaths, and because they lack this empathy, they tend to be impulsive, emotionally very shallow, selfish, and highly manipulative of others. Most of them, because they lack empathy, because they don't care about other people at all, because they can't care about other people at all, they tend to commit crimes. Most of them are criminals, or many of them are criminals, but most of them aren't going to run around, stabbing people, because they know they're going to get arrested for that, and they're going to spend the rest of their lives in jail. Just because they're antisocial, that doesn't mean they're stupid. So they're not going to do things that are unnecessarily risky. But because these people pretty much live their entire lives without empathy, they will learn from a very early age that they should fake it. Like, they'll learn that there's something wrong with them. There's something different about them, and they need to compensate for that by lying all the time. So they're constantly lying about their caring about other people. And in fact, it's extremely hard to tell the difference between somebody who is perfectly normal and somebody who's antisocial. The only surefire way to tell the difference is to hook them up to a polygraph machine, for example, and just show them pictures of, what things that most of us would be disturbed by. And if their, autonomic nervous system doesn't show that same level of disturbance, then that would indicate that they're probably an antisocial. But because they know that there's something wrong with them, and because they have to lie their whole lives, they actually become very good at this. They become like masterful liars, and they can be very charming. You always hear in the news about how some crazy serial killer gets caught and none of his neighbors knew. It's like, he's always such a great guy. Yeah, that's what antisocials do. They make good impressions. They are nice guys, until they stab you in the back. And just like all the other disorders we've been talking about, antisocial personality can also have similar causes. So, childhood problems, emotional deprivation, physical abuse, these kinds of things. But just like the other personality disorders, you're not going to be able to effectively treat somebody with antisocial personality. Because, in fact, it's one of the hardest personality disorders to treat because, like I just said, these individuals are masterful liars. They manipulate, they cheat their way through lives. So it's really hard to tell if somebody who is antisocial, if they're actually getting better, or they're just pretending to get better so that they can be released from your custody.